Hello and welcome to our webinar, Debunking the Medical Marijuana Myths. This is Dr. Jessica McCain. Just to give you a little bit of background on me, I am a board certified family practice physician. I am also certified in the state of Florida as a compassionate care physician, meaning that I am authorized to recommend medical marijuana in Florida for purchase at a dispensary. So I've been studying and practicing medical cannabis for 3 years now at Southern Comfort Marijuana Clinic in Port St. Lucie. And I'll tell you that this was not anything I was taught in school. Everything was self-learned. And in fact, when I asked to study about medical cannabis because the legalities were changing and patients were asking, they did not really appreciate my interest. And the attending doctors pretty much just said, no, this is just for recreational. We don't think we're going to be doing it. And I have found the total opposite. So when I got into private practice, I found that I had some missing parts of my medical tool bag. I wasn't able to treat things that I wanted, and I was at a situation where I had a patient who was um, really struggling with end stage cancer and had issues with pain management. And he came to me saying, what can you do to help treat my pain? And I felt the only thing I could offer was to increase his pain meds, his opiates that he was taking. And he said, absolutely, find something else for me. I'm not going to do that because they make me so groggy. They don't really make a difference. I can't say goodbye when I'm not in the right mental state because of my opioids. And so it was that night that I went home and I started researching about medical cannabis and learned that there's actually really a lot of science about the use of it for medicinal purposes. So that's kind of my introduction into getting to the medical cannabis industry. And so we're going to talk about how we're doing it and the science behind medical cannabis. And we'll start with just looking at history. The word marijuana has a negative connotation. So you'll notice that during this conversation, I'll kind of use interchangeable words, cannabis, medical marijuana, different from adult use or recreational cannabis. But this really refers to the species of the plant as a broad term of cannabis. And then what I like to do is use the word marijuana just to purposely desensitize it. So it can be a little bit confusing because cannabis is actually inclusive of marijuana plants, but also hemp plants. So what makes that difference is it's a federal designation regarding the chemistry of the plant, with hemp being essentially free of the psychoactive part of it, the THC, which is tetrahydrocannabidiol. So hemp has been inbred for generations for a more industrial use. It can be used for more than 25,000 commercial products. So when we're talking about medical cannabis, we're really referring to marijuana, the product of plant that comes that includes the THC components as well as all the other chemicals. So again, I'll try to be as specific as possible, but when we refer to cannabis, we are referring to both hemp and marijuana and recreational and medicinal uses. So this is just an image of how things were packaged in the early 1900s as cannabis was seen as a medicine. So why is marijuana taboo? Again, I like to start with a history lesson because we need to understand why, as of today, there aren't a lot of physicians practicing this. There's less than 2,000 in the state of Florida that are certified, and certainly not all 2,000 are actually participating. They just pretty much took the exam to let them be qualified. But I want everyone to understand it's because we have the same misguided education that the public did. We were misled by our education system that cannabis only has one use, and that would be recreational or adult use. So really, medicinal cannabis is traced back to 2700 BC, when the Chinese emperor Shenyang, who is considered the father of medicine, was actually documenting about the healing properties of marijuana, and he was using it for dementias and rheumatoid arthritis and gout, and it was kind of in the same league as ginseng, for example. So in the early 1800s, when the settlers came to the United States, they were actually required to grow cannabis, probably more of that hemp brand, at 200 acres in order to have ownership of their land. In the early 1900s, there was actually like 2,000 different tincture products with those bottles that I demonstrated, and that's kind of when the problem started, I would say, is because, these companies started adding morphine to it. And that's what really led to the addiction problems and social ills, and kind of gave way to the government saying, we need to create some industry standards and regulate medicines in the United States. But there's also some other things going on, political agendas, and of course, that's what led to the ultimate prohibition. But in the early 1900s, there was an influx of Mexican immigration. So the southern states were really pushing to prevent that from happening, and they were using marijuana. That's where the derogatory term came from, referring to the plant that the Mexicans were bringing in and saying that it should be all illegal. So by the end of 1936, all 48 states had actually enacted laws to regulate marijuana. And it's really kind of an interesting mirror when we're thinking about the early 1900s with the opioid epidemic and the crackdown on the use of cannabis because of that association to the opioid epidemic of today, where we're actually using marijuana to treat that problem. So I just think that's just a phenomenal mirror, but a kind of a ironic situation. So the decline of using cannabis as medicine was really hastened when Harry Anslinger, who is the first U.S. drug czar, and he served for a really long time, from 1930 to 1962, he created the Federal Bureau of Narcotics, and he created this facade, this absolutely false presentation that marijuana causes insanity and pushes people to horrendous acts of criminality. That movie, that Reefer Madness, came out, and he really just wanted this consolidated control. And all the meanwhile, you know, the American Medical Association was coming out saying that you have no medical basis for making these assumptions and trying to regulate without any scientific basis. So they came out and publicly were against it. But of course, in 1939, the pharmaceutical companies are already starting to show themselves. They invented aspirin and oxycodone came to the market. So why do we need marijuana anymore? And then in 1942, it was removed from the pharmacopoeia, which is the PDR. It guides physicians. Even today, we get one every month that shows all the medicines, what their doses and what their indications are. So when it was removed from the PDR, that's when using cannabis medicinally became a true crime. And just another fun fact that minimum sentencing laws for simple possession of drugs, or just in general, minimum sentencing laws for crimes, was actually first applied to possession of simple marijuana in 1959 with the Boggs Act. So really, it was really considered a very big crime to have cannabis possession and use. In the 1970s, the Federal Controlled Substance Act was put into place, and it created it put marijuana into a Schedule 1 drug, meaning that it has a high potential for abuse, no currently accepted medical use for treatment, and it was abusable. Now, any drug that is put into a category can be declassified, and the Attorney General actually has that power to do so. So they created a group called the Schaefer Commission, and they actually came out with a report that said this actually should be declassified and decriminalized. And what happened, though, is that President Nixon in 1972 vetoed the Schaefer recommendations and the Attorney General in their recommendations to decriminalize cannabis use. So here we are, throwing back. Public enemy number one is marijuana. Women cry for it, men die for it. Weed, the roots of hell, horror, shame, despair. And here we are now in 2020, and we still have a lot of people thinking that this is a true crime and evil, and it's just going to lead to decline of our society if we just, you know, legalize cannabis use. So the historical propaganda was pretty much admitted by John Ehrlichman in 1994. He did an interview, and he was the White House counsel for domestic affairs under the Nixon administration. And I love this quote because I think it just seals the deal and makes us really understand that we were getting some wrong information. He said, "We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did." So there's always an agenda. And as a result of that agenda and as a result of the prohibition, we have lost this great art of medicine. So the vast majority of physicians are not taught this in any of our coursework or in residency programs since it has been removed from that official pharmaceutical database. We believe that marijuana is a gateway drug when really it's an exit drug. There's a general understanding parents are telling their children don't do drugs, and that has really kind of led to a negative connotation when truly a lot of people turn to alternative drugs when they can't access marijuana, or they come off of more dangerous pharmaceutical drugs or illicit drugs with the use of marijuana. Criminality, the greatest damage that you can have from using cannabis today is really truly criminal. Black market dependency and corruption. In fact, we know that there is a 4-time higher incarceration rate for possession of cannabis in the Black communities, and it has led also to the high cost of healthcare in the United States. in that regard, when they did a study in 2013, and I believe that there were only 17 or 18 legal states in that time. So of the 17 or 18 states, they did a study using Medicare Part D program spending of how much was spent on pharmaceutical medications in those states compared to other states. And they found that in those 17 states, they saved $165 million that year. So this is, again, one of the reasons why cannabis is not fully legal today is the pharmaceutical companies, the lobbyists. In fact, the top lobbyists against cannabis are the pharmaceutical company, the prison system, and the alcohol and tobacco industry. So this image is just showing that in the United States, we are progressing, we are moving forward. If we're just looking at CBD, all but 3 states have laws regarding CBD use. Majority of states now do have medicinal uses, and a lot of them are starting to have recreational uses. At the end of the day, though, it is still federally illegal to possess cannabis and use cannabis, but it is currently undergoing a states' rights evaluation. So in Florida, we're going to talk about how it has been fast forward to today's time. We've got 33 states, including the District of Columbia, DC, has legal medicinal use. 11 states have it in recreational form. 15 states have decriminalized it. And in 2016, the state of Florida, with 71% of the voters signing it in, gave Floridians access to the medicinal use of cannabis. Now, there are some restrictions. The state of Florida said that, of course, if you have one of these qualifying conditions, you are automatically eligible to be a medical marijuana user. That includes cancer, epilepsy, glaucoma, HIV/AIDS, PTSD, ALS, which is Lou Gehrig's disease, Crohn's disease, Parkinson's, multiple sclerosis. And here is where I come in mostly, is that as a physician, I have the ability to say if there is a condition similar in the way that it presents itself, symptoms, or the way that the pathology happens similar to those above diseases, then we are able to qualify patients outside of those listed conditions. So we do that very frequently for our patients, for example, who have chronic pain related to pinched nerve causing muscle spasms, very similar to disease like multiple sclerosis. If someone has IBS or ulcerative colitis, celiac disease, the pathology, the symptoms very similar to Crohn's disease. So really, this list is not meant to be completely exclusive. It does give the ability of the physician to make judgment calls and to provide extra documentation to the state to show that you are eligible and also could benefit from using cannabis. I like to talk about some myths. One of them would be the Veterans Affairs, the VA. A lot of people feel that they cannot access medical cannabis because they use the VA benefits, but on their website, they actually encourage patients to be open and honest with their VA doctors. Of course, they can't recommend or prescribe, but they are certainly not going to remove any of your benefits. They have another rumor that we hear a lot is I can't possess a firearm. They're going to come take my firearms. In Florida, again, that is not accurate. As of now, actually, the Commissioner of Agriculture, Nikki Fried, when she was put into office recently, actually, like on the second week of her appointment, she came out stating that she is both a medical cannabis user and she has a concealed carry, and she is not does not have any intent to make it a crime to have a concealed carry and be a cannabis holder in Florida. So the trouble, though, truly though, is when you purchase a firearm, you have to fill out a federal background form called the ATF 4473 form, and so you may be denied purchase of a gun from a licensed dealer when you do that, because question number 8, and they made an edit to it, says, true or false, I do not use illicit drugs. And then they put in parentheses, including medical marijuana, even in states where it's legal. So that is really the catch when it comes to the firearms. Your firearms that you possess are not going to be an issue, and it's really the purchase of a new firearm that has held up in court as could be restricted. Now, of course, anything I'm saying regarding legalities, things change, and of course, I'm not an attorney, so these are just from experience and precedent that has been previously sent. The other thing too we hear a lot of is that patients are getting kicked out of their pain management clinics, or they're told by their pain management doctors that they are not allowed to be on both. There really is no rule. There's no order to that says you can't be on both. That is a complete office policy, and we have found pain management doctors both favorable and working with us, and some that absolutely do kick their patients out. And in general, I feel what we've been educating our patients is be open and talk to your pain management physician. It's a lot easier to be open and honest, and have that expectation when they do drug tests, and then they would do more of a compassionate wean or let you use both products simultaneously. So let's go into the science behind the use of cannabis medicine, and I'll refer you also to our website, www.socommjclinic.com. I do have additional videos on our FAQ section of our website that really go in a lot more detail about the science and specifically the use of cannabis, how to read labels and use it. So that is another really great resource for learning more and being educated about the facts of cannabis. One thing is true that still a lot of physicians say that they cannot be behind the use of cannabis because there's just not enough research. And the fact is that's completely false. In fact, the United States government feels that there's just enough evidence that they actually have a patent, I'm sorry, on the medical use of cannabis, and this patent expires in 2021. So I'm sure that there's going to be some federal changes once the United States doesn't have that patent anymore and it's open floor. But right now, they recognize that there is antioxidant benefits that could be used for ischemic. We're talking about stroke-related damage, age damage, inflammation, autoimmune diseases that could impact trauma, stroke, neurodegenerative diseases like Alzheimer's disease, Parkinson's, and HIV. So all the meanwhile, there's been this Schedule 1 prohibition of research in the United States, but all the meanwhile, the University of Mississippi has been doing research for the United States government since the 1970s. They've been growing the most potent type of cannabis plants, and they actually have a database where when they collect plants, the police and they actually send it to Mississippi for analysis and for future cultivation purposes. What I use when I talk about and try to educate other physicians about the research that's out there is a database called PubMed. So PubMed hosts all the scientific journals, and you can do word searches. And here's an example of a word search that I had done in February. I did a search for cannabinoid, which is the chemical that comes from the plant, and there's 27,000 studies there. So know that there is plenty of research that physicians can access if they are open-minded enough to look into the database. So the THC molecule was actually discovered in the 1970s by Dr. Michelin. And that is what eventually turned into the synthetic version of Marinol or Dronabinol, which is a pharmaceutical production of THC. Now, I've used Dronabinol or Marinol in patients, and a lot of times it's unwanted, unpleasant side effects because it's such an isolated part of the plant that it can cause those negative, unwanted events. In 1992, it was further discovered that all humans and plants, we actually have this system called the endocannabinoid system that mimic each other, and that endocannabinoid system actually regulates a multitude of bodily functions. So in 2013, when they did this medical school analysis to say, hey, is anyone talking about this endocannabinoid system? It's actually a big regulatory function in our body. Only 10% of the medical school said they even mentioned this in their curriculum. So this again is why we've got the dichotomy in our culture today saying that there's not enough research, but there is. It has medical benefit, but it doesn't. This is why there's so much confusion about it. But again, if we look outside the United States, Israel, for example, they are doing human trials. In fact, they're doing human trials right now using CBD and COVID. So there's plenty of research going on if we just are open to alternative sources of it. So again, I like to say we need to get away from the prejudice that marijuana is a gateway to other drugs. In fact, it is harm reduction. People are coming off of other more harmful drugs to use cannabis instead. So that's what we mean by harm reduction. And people have been self-medicating all along. It's just now they're coming out and be more honest with it with their doctor, so we can do a little bit more strategical analysis on the benefit of it. But here was a study that was done on 350 users in California, and 40% said they'd use it instead of alcohol. 26% they used cannabis instead of illicit drugs. 66% found that they were using it instead of their other pharmaceutical drugs. Now, why is it okay that we are using cannabis and people have been all along is because it's actually really safe. The FDA on their actual website says, listen, there's never been overdoses reported from cannabis use. Scientists have actually tried to create an overdose situation. They gave a monkey 9,000 milligrams and they couldn't kill the monkey off. It just slept for a solid couple of days. So we know that the safety profile is actually really good, no organ dysfunction or things like that. And part of the reason is there's no receptors, those cannabinoid receptors in the brainstem that control the heart rate or lung respiratory rate. So you're not going to have the same sort of cardiorespiratory depression that you would, for example, if you took benzodiazepines or opioid medicines. However, because it is very relaxing and blood pressure can go down with cannabis use, we do say, be cautious if you do have existing cardiac disease or congenital heart defect or history of stroke, just because that lower blood pressure can cause impact in those other diseases. But what else can cause a lot of deaths? Alcohol can, 88,000 deaths a year. Tobacco can, 480,000 deaths a year. But again, FDA says none from cannabis. We do have to appreciate, though, as a medicine, it can have negative side effects. So while I can use the word, yes, you can actually overdose. It's not the same as death, but it can be very uncomfortable. So most common side effects can be, for example, if you take too much of it, you can get excessively anxious and paranoid or excessively unhappy. You can get a cough, an increase of bronchitis. You can have slowed reaction times, being extra sedated, dry mouth, dry eyes, redness of the eyes, dizziness. So these are all considered very mild side effects from using cannabis. And what we'll talk about later is, depending on the method of how you use it, you can be done with these side effects in a matter of hours. So it's nothing lasting. What we also need to be mindful of is the production of this. It's not done in pharmaceutical standards, but what we have in Florida is a regulatory system where the dispensaries are very closely monitored. It's a vertical integration system, meaning that the dispensaries, the storefronts where you're buying your medical cannabis, are actually also the same company that is growing it in a nursery. So it's very controlled. So from seed to sale, it's all one source. So if there's any issue, they can track down where it's coming from. Also in Florida, all the dispensaries are fighting in a way competitively to be the cleanest product. So are not using like organicides and pesticides, and they do undergo independent lab testing, which you can request, that searches for like 14 different, funguses and molds and different types of other chemicals that are used sometimes in the farming industry. So if you're getting your cannabis from a legal dispensary, I have a lot less concern about any additional toxicities, whereas if you were getting it from your local cannabis dealer, you're not sure where it's grown, what products they are using, or kind of growing initiatives or pesticides that they have. And this is, again, important for people who have immunocompromised systems, that they're getting it from a reputable source. Medscape is another resource that physicians are really familiar with, and we can use it a lot for looking at drug-drug interactions. And if you type the word marijuana into this drug interaction checker, and you can put it with your other medications, of course, realizing that cannabis hasn't been studied with every pharmaceutical medicine, but we can understand the mechanisms of how it works, and in general, what medications are okay or absolutely contraindicated. And you'll see that there's 4 listed there that are absolutely contraindicated, don't use with marijuana, but all 4 of them were taken off the United States market because they were so dangerous themselves. So we don't have to worry about those. Now, the ones that say use alternative, this is in theory. And again, there's strategy. If you go to a physician that can explain how to use cannabis, the likelihood of you causing any of those things are so rare that it's really not an issue. So really, cannabis and other medications are pretty safe. So let's get into, again, talking a little bit more about the science. What they found in 2003 is that this natural cannabinoid system, they can do blood work now to see what your own levels are of the comparable chemicals. So I've mentioned CBD and THC. That's what the plant has. In the human body, we have the analogs of it. That would be 2-AG, 2-arachidonoglycerol, and anatomide, ANA, AEA, I'm sorry. So I'm just going to say CBD and THC because that's just common terms, but basically we have those same chemicals in our body. And so these chemicals are neurotransmitters, which means chemicals that talk to other cells and other nerves. And the bodily functions, when I say they regulate a lot, they are involved in the GI tract and appetite, endocrine. We talk about like diabetes and metabolism, mood, memory, immune system, inflammatory regulation, the cardiovascular system as far as reducing blood pressure, motor and coordination, temperature regulation, reproduction, all of it. So in 2003, when they recognized that we can do lab work to check our levels, and people who had disease had low levels of CBD and THC, they can now say that you've developed a clinical endocannabinoid deficiency syndrome. So now we actually have that a syndrome can lead to diseases downstream, because we know that life, stress, and disease will deplete our natural cannabinoids, and that is what leads to imbalance and disease. So these are some examples that they actually, so no example on here, by the way, is without scientific data in a published journal. So these are all the different conditions that can help with the use of cannabis supplements. You're just supplementing a natural deficiency. And you see this list, and of course you're saying, well, now it's too good to be true. This has got to be a snake oil. But again, these are all based on scientific publications. Now, we also can recognize that when you're taking cannabis, you can get some health promotion. And we can say this because chronic cannabis users are 1/3 less likely to be obese, have issues with blood pressure, cholesterol, or diabetes. We know that there's lower occurrence of cancers with cannabis users and osteoporosis. It can help with cognitive decline, definitely some anti-inflammatory autoimmune conditions. Sports teams, what is it now? We've got the NFL, baseball just legalized the use of cannabis, or they're not going to be, throwing people out of the game because of it. And NFL is looking into research, because what they're showing is, even after concussions, the use of cannabis reduces the volume of stroke damage in the brain. And same thing with heart attacks. They're showing that potentially it can be lesser damage if they had cannabis in their system. So again, it may seem like snake oil, but at the same time, you'll find yourself in a good debate with someone who's done their research about it. And this is just a nice simplified explanation. Again, we've got the endocannabinoids coming from our natural system. We've got phytocannabinoids. Those are the same chemicals when it's produced by a plant, and synthetic cannabinoids that have been produced in laboratories. They all work on the same receptors, and that's how they can, at the end of the day, address medical conditions. This is an image showing all the different receptors in the body. And so we talk about CBD and THC. CB1 being mostly in the neurologic system, CB2 receptors in the peripheral part of the body. But they obviously have a great control over bodily functions because they're just so widespread. There are more receptors for cannabinoids than there are for serotonin and dopamine, which is really strange considering, hey, this is a system that just got discovered in 1992. Where have you been? So this again is now that we've got the technology and the science, it's almost like irrefutable to prove that this is really a valuable system in our bodies. This diagram is actually a little bit confusing because it's just saying, as soon as you know something about marijuana, you actually realize you don't even know enough. It is what we call a dirty drug. And I think at the end of the day, that can actually be a good thing. So what I mean by dirty drug is in the pharmaceutical world, they focus on a single medicine targeting a single receptor to do its function. But what you end up having though is you get a drug, oh, use this to treat your depression. And the next thing you read is this also may cause diarrhea, heart pain, and a whole list of other side effects that now you're taking medicines to treat that side effect and another medicine for a side effect. But when cannabis is actually a dirty drug, that may be the beauty of it. The fact that it can hit so many receptors that you're taking that shotgun approach, you're really addressing the problem because you're hitting it from more than one angle. You also have a checks and balances. So maybe when you start to get a side effect, that the checks would be that the other receptors would make up for it. So maybe that is why this is, although a dirty drug, it's actually a lot safer than pharmaceuticals because it does have that natural checks and balances. So medical conditions are a combination of electrical imbalance, chemical imbalances, and perception. And so when you have a marijuana plant with 400 different chemicals, that's really how you're going to treat all those different modalities of disease. So when we talk about CBD and THC, these different initials, there's actually 113 different cannabinoids. And that's just, again, the components from the plant that has been identified for receptor and medicinal benefit. So we talk about using cannabis as the spice of life. We don't want to just extract the THC because it just doesn't give the full benefit. It's really when we start using all these different versions. And now the level of science is actually, though, really concentrating CBD for some uses, THC for some, but the plant actually, in all of its different forms, has a different benefit. So what I mean by that is we need to make sure we're giving access to the full plant to medical patients in its raw form. If people were to eat it, you actually cannot get high from it. It has types of THC that's called THCA and THCV. You have additional benefits of diabetic control, anti-seizure control, anti-inflammation, anti-cancer, and so forth that you get from the raw plant that you lose as soon as you start heating it up or going through the extraction process. Once you heat it up, you get 9-delta THC. Now that's where some people can get the psychoactive benefit from the cannabis, the high that some people experience. If you ingest it, it's going to go through the liver. Now it's turning to 11-hydroxy, which a lot of people with chronic pain will say it's more of a body type of high. So again, there's a lot of different types of chemicals that come from the marijuana plant. We want to respect that. We want to respect that patients need to have access to a different types of methods of use in order to get the big variety of chemicals that will help fight the needs of a patient or help treat the needs of a patient. Pop culture has tried to simplify a lot of the way that cannabis makes you feel, and they've kind of done good with it. And sometimes we do need to simplify it because it can get into a black hole of research and learning and be a little bit complicated for patients. But let me just try to explain it that the term sativa, indica, and ruderalis, which is what they would say hybrid at the level of the dispensary, again, go really back to the botanist, the person that's growing. It's important for them to know if it's a sativa or indica because it'll affect the way that the plant is grown, whether it's in a dry environment or wet, and what type of nutrition it needs. The way pop culture has said it is that sativas are very activating and energizing. It starts your day, sativas. And indicas are very relaxing, and it's indica, it's in nighttime use. And what we can appreciate that these sativa and indica benefits are really a reflection of the terpenes that a plant has, the essential oils. So essential oils are really popular for medical use. I guess I wouldn't say really popular. Again, there's physicians who believe in it and some physicians who don't. But there are plenty of studies that show, again, that essential oils do have mind-body effects. Maybe not to the same degree that CBD and THC do, but certainly they do have mind-body effects. That's why we know that lavender is very relaxing. You go down that baby aisle, every baby lotion has lavender in it. We do peppermint for upset stomachs, and we've got orange zest to kind of bring us up and energize for the day. Well, exactly. Lavender is an indica plant and oranges are sativas. So that's kind of how we can integrate the thought process of the marijuana plant and using the essential oils as like cherry on the top, right? So we can use CBD and THC, maximize the benefits that they provide, and then we can use some essential oils and terpenes to really, really fine tune a patient's medicine to give them energy in the day and to treat their insomnia at night, in addition to using the CBD and THC to actually treat their medical problem and treating those symptoms that come with those as well. So this is just a really kind of a great analysis or a great depiction of how indicas and sativas can have a medical benefit as well, just because of their essential oil profiles. So when you come to our clinic at Southern Comfort, we do treat it as it's a true medical clinic. We like to give advice and explain the science and education because we want to make sure that patients are getting the greatest success. It is the greatest gift we can have is when patients come back and their quality of life is dramatically changed. People going back to work, families not getting divorced, people going back and playing golf. I mean, examples endless. Last week I had a patient who was I kid you not, she had end-stage metastatic breast cancer and she was on hospice and she was using cannabis for palliative care, but she is so much stronger and just more of a vibrant person that they actually took her off of hospice now, and this is her treatment. She knows it may not cure her cannabis or cure her cancer, but her quality of life is to where she feels that she is resuming with normal activity. So examples galore I can give over the past 3 years and the thousands of patients that we've seen. So, getting to our recommendations, this is just a very short explanation. So, number one is we talk about CBD and THC, and we say use both. When you get to the dispensary, sometimes they are encouraging the use of THC. I believe that's where their biggest profit margins are. A lot of the trained technicians, maybe they have experience with cannabis as far as adult use or what they've had in the past, maybe not necessarily for medicinal uses, and it can provide some good comfort and sensations. But really, when you use CBD and THC together, you're going to get the better effects. Remember that electrical, chemical, and perceptual control, you don't do it with one or the other. You really kind of need both. So you'll actually have cost savings. CBD and THC enhance each other. So when you have both, you'll be spending less total milligrams. So again, that may be one of the reasons why dispensaries really push THC and not the complement of both. Um, You'll have less side effects. So THC is what is known to cause the majority of the negative side effects. People say, hey, I used this back in the day. I really didn't like it. I'm begrudgingly trying medical cannabis again because I'm out of options, but I don't want to be high. You don't have to be high. You absolutely don't. We don't encourage you to, right? In the right time and place, if you're a really depressed person, sure, if you take a little bit of cannabis that might get you a little bit euphoric, there's not a problem with that. That's medicine for you, right? But you do need to be focused, you need to be safe, you need to be coordinated, certainly throughout the day. CBD is your antidote. So CBD takes away the psychoactive parts of THC, but leaves all the medical parts of THC behind. So if you ever feel like you overindulge or you try something that you're not comfortable with, you can take CBD and reverse the side effects. Even if it's just sedation, you can reverse that side effect. So really, it is important to have both. The second thing we talk about is start low and go slow. And again, when you get to the dispensary, they are salespeople. They're in it to sell per the milligram. And if you could take 200, that makes it good for them. But really, a lot of studies are saying that cannabis should be used at a much lower dose to be a true supplement. If you start using it at a higher dose, consider it like a pharmaceutical because you're going to be shutting down your natural system. And I'll show you a graph that kind of illustrates that. And then finally, the key to a prescription, right? You talk about what it is you're taking, how much, and then how you're going to take it, whether you're going to be doing it orally or inhaling it. We need to remember that cannabis can be used as a maintenance method, actually to control the medical problem. And for that, you want something that lingers in your bloodstream long enough to actually address the problem. But if you just got a place to go, you've got a panic attack that you feel is about to happen, that migraine aura that you're sensing, you need to stop it in its track. You want a crisis method. You want whatever is going to work fastest. So you'll find that a lot of successful patients have more than one method that they're using throughout the day. They may have a daytime blend and nighttime blend. They may use the inhalation sometimes or drops or something else another time. And it's because they're actually addressing their medical needs in a very kind of scientific fashion. This is what I was talking about as far as dosing. And it's really great science coming out there because before, I'm going to use the example of using it for cancer. Rick Simpson was coming out saying you need 60 grams of cannabis a day, 1,000 milligrams every day for 3 months. And GW Pharmaceuticals is actually taking a 1-to-1 cannabis CBD THC preparation, and they're giving it to patients with brain cancer, glioblastomas, and I'm talking like 2.5 milligrams, really small, even less than that doses, but they can use it up to 10 times a day. And they're seeing great results, like as in after a year, the survival rate of glioblastoma is 20%. They're seeing now survival rate up to 80% at really low doses. And it's again going back to this curve that more is not always better. At really low doses, what you're going to do is stimulate your natural cannabinoid system, which has been just burnt out. Maybe it was fighting the good fight and it's just got burnt out. When it senses you're getting it from an outside source and getting benefit, it's going to crank up its own production again. So you're going to be using it as a true supplement. But again, it's all about checks and balances. So if you take too much and you start to get negative side effects, your natural system is going to decrease its production. So now you're in the hole and you're feeling bad again. And what do? You go to the dispensary telling them that, it's not working anymore. Oh, that happens. You develop tolerance. What you need is to take more. And if you do take more, certainly you'll feel good again. You'll be on the 100 milligram rather than the 10 milligram that you were previously, and you'll feel good again. And you're never going to go backwards at that point. But that is it. That's truly, you can develop tolerance because your natural system, the receptors are actually protecting themselves and turning off and deregulating. So you'll start to develop what's called tolerance. But what I really want to emphasize is tolerance is temporary. You can take drug holidays, meaning that you can take 2 days off and your natural receptors are actually out of your body by 50%. So now you've reduced your dose by 50%. And patients who come to me saying, I've been self-medicating since I was a teenager, I know I need a lot. Well, certainly, maybe you do. Maybe you were born that way. Maybe your natural system will never come back to life, but let's give it a shot. Let's take 6 days off. And now all the active cannabinoids are not bound to receptors anymore. And so you can give it a good clean start. It takes about 4 days of starting low. I'm talking about like a milligram, increasing by a milligram each day. And it's usually around 3 milligram, 4 milligrams that people will start feeling the benefits, usually around day 3 or 4. Um, just a side note, I say that 6 days, it's kind of out of your system. What I mean is it's active properties. Now, it is in your bloodstream in a way. It gets deposited in your fat, the inactive metabolites. So when you talk about drug screens for employment purposes or for legal purposes, people can test positive beyond 30 days, depending on how much they use, what the fat content is of their body. So it's not the same concept. So when they're talking about drug testing and impairment, it's very, very difficult because it's just showing that you've used in the past 30 days, not that there's any active receptors or active cannabis working at receptors. This is another trial I really do want to try to hit home about. Less is more, and it was done on a study of 360 cancer patients with metastatic bone pain who were not responding anymore to opioids. They have maximized their medicines for that, and they put them into 3 different groups. A low group who took the most, maximum 20 milligrams a day. They were actually starting at less than 5, and they could take up to 20. A moderate group or a high group that was using more than 80 milligrams a day. And again, the group that was dosed with the lowest amount actually had the best results. And the medium group said there was moderate pain control, and the high group said that it was no more than what a placebo would have done. So this, again, is just a true human study that was done on a one-to-one. Pharmaceuticals are legal and they could be studied. So that was a one-to-one pharmaceutical grade cannabis product. So let's talk about the different methods of ingestion, because we talked about maintenance versus using it for breakthrough or crisis control. And there's really a lot of ways to use marijuana. So when people come and they say, I have asthma, I have COPD, I can't smoke it. Well, to be honest, actually, that is not a contraindication. And I do have asthmatics and COPD who inhale cannabis and they are feeling that it actually helps them cough up. It loosens the mucus. THC expands the airways. And if we look back at those pharmacopoeias from the early 1900s, they were given THC as a drug for asthmatics to open up the airways. So it's really fascinating. But there are really a lot of different ways. The most popular would be the inhalation. So they have vape pens. They have where you can smoke the raw bud. Vaping is healthier than smoking because it is at a lower degree temperature. So you're not introducing tar because of combustion. You're not burning off, milligrams. So we do encourage patients to vape the raw flower is probably like the best way. Vaping the liquid extract, of course, there's been a lot in the news about that. And it is in regards to whether I believe if you're getting it from black market, you're not really sure what's going into it. The development of the vape pens, if they've got plastic components to it, that's not all that good. There are dispensaries who've got it figured out where all they have as far as the liquid in it is just marijuana. Whereas we were seeing in these cases where at the lung disease, they were getting other problems because those companies were using like vitamin E oils and other things. So you have options. Again, just go to the company that's got it figured out. They use ceramic or glass vapes and for their products, and it's marijuana only. It doesn't contain any of those MCT oils. But inhalation is the fastest way. You'll experience the benefits of it within minutes. It just doesn't last very long, so 2-3 hours. So when I have patients saying that they can get to sleep fine, they just can't stay asleep, or that they're using inhalation cannabis 7 times a day and it's just they're running through it very fast. Well, that means that they need better maintenance control, something a little bit longer lasting. Sublingual drops are probably the preferred way. I would love for patients to start using cannabis medicine because it's very controllable. You can go drop, 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 1 milligram, 2 milligram, 3 milligram. The effects are very predictable every time. The science is there where you can get consistent blends of it, and they can, look at the labels and you're getting the same product every time versus flower. If it's grown differently, it may have a different property to it. Sublingual drops can take 30-45 minutes to kick in. You can make it work a little bit faster if you brush underneath your tongue, just get that dead skin off, open up the blood vessels, break them up a little bit. Then maybe it's 20 minutes to kick in. And you can also rinsing with hot water opens up blood vessels, sucks the medicine in a little bit better. But again, those affect 6 to 8 hours. So that can be something where someone, takes an inhalation to get to sleep. They'll do drops at the exact same time. So when they're finally kicking in, they're keeping them to sleep and they're getting that first good night's sleep they've ever had in 15 years. Heard that so many times. And it's like, wow, sleep's actually really important. Yeah, it is. A good night's sleep is really important for daytime functioning, and sublingual drops will help kind of keep you asleep. Oral methods will also do the same thing. Oral methods can stay in your bloodstream for like 12 plus hours. So you kind of have to be committed to it. They're a little bit less predictable, and I will say patients get more negative side effects from the oral methods if they choose the wrong formulation. So you just got to go a little slower, still in taking like 2, 3, 4 milligrams. A lot of people, when they hit 10 milligrams, they'll start to get those unwanted effects from it. It takes 2 hours to kick in, so it's something that would be more of routine use, but someone can take it at 7 p.m. and again, holds them throughout the day. Oral methods do seem to target chronic pain a little bit better in my experience. Part of the reason why is, again, with the chemistry changes, when you take medicine orally, it is going through the liver and turning into a different type of THC compared to if you were doing the inhalation or under the tongue. Those are going straight to the bloodstream as 9-delta. So when you're ingesting it, it's 11-hydroxy. And so different mind-body experience, that's when people will say it's definitely more of a body high. So what we do with our patients is we start them with the sublingual drops plus or minus inhalation. And then if they're not getting their needs met, let's progress to oral methods, because definitely it can provide some benefit that maybe someone doesn't get with the other methods. They also, I'm sorry, one other thing about oral options is you can also eat the plant raw. I feel like I'm doing a lot of education recently on that. You can take just a little pinch, chew on it for 5 minutes. Fun fact, you can't get high from it. It doesn't have that type of THC in the raw form, but it does have additional anti-cancer, anti-seizure, anti-diabetes, inflammatory control that you don't get from any of the other methods. So again, variety. I brought that up now a couple of times. Going back to the chart though, topical options, some really great reports from patients who are using lotions, creams, and patches, but they have even suppositories. So suppositories out there for both male and female use. Maybe you have a GI issue and you've got colitis, you've got prostatitis, a lot of gynecologic issues, dyspareunia, endometriosis. There's a lot of studies actually that are women initiative studies that have studied the benefits of cannabis for different issues, and suppositories are definitely an option for patients. So this is an example of what vape pens can look like. On the left, those are what we would consider more of the disposable vape pens, really great for someone who doesn't have the dexterity or to hit the buttons. They actually are just like pre-filled and you inhale and it turns on by itself. And then you can get other ones that obviously get a little bit more complicated that you can refill and use again. This is an example of sublingual drops. You'll see that it comes like in an eyedropper and really easy, again, dosing. This is when we talk about the oral options. You've got capsules. We always encourage patients to, again, freeze them, cut them in half, try to start with the slowest possible dosage that you can, or edibles. Patients are making their own. They'll find that it becomes a lot more cost effective when you start to DIY, do it yourself. You can make your own drops, sublingual drops. You can make your own edibles by melting chocolate and pretty much just cutting them out, and you have some pretty good control. So those are some other methods our patients are frequently using. Just some examples that there are creams, and then the suppositories. And I have a gentleman that makes his own suppositories too. So he's a truck driver, and so he finds that that's his preferred method. So here we are again in Florida. We have the option to get patients access to this integrative type of medication. It is regulated by the Department of Health. The website to access their website, and this is actually a really great reference because this is the list of all the different dispensaries out there with their website, so you can really easily use it as like a yellow pages and do browser shopping, see where new stores are coming in. There's like 14 different dispensaries, and lots of different stores opening up every day. So know the facts, mmj.com is the Department of Health website, with a lot of great frequently asked questions and the regulations, but also the dispensaries. Just to note that we call dispensaries in the state of Florida medical marijuana treatment centers. So when you see the abbreviation MMTC, that's what they're referring to. They're not going to use the word dispensary just because of legal reasons. In order to get a card in the state of Florida, you have to be a Florida resident or a seasonal resident here for at least 31 days, and that has to be documented. And this, in the Department of Health has specific criteria of what they will accept for documentation. You have to be diagnosed with a qualifying medical condition, and as I explained, there's a little bit of leeway for physicians to look at medical records and decide if you meet that criteria. Criteria being it has to be a chronic condition. Chronic is usually defined as more than 3 months, and it has to be debilitating. And what debilitating is defined as impairing the quality of your life, minimizing your strength or your functioning in order to perform daily activities. What we do as physicians, we certify that you meet that criteria, register you into the state system, and then the state will kind of take over and issue you the ID card. Now, this is where it gets a little bit confusing, and I feel like we do excel trying to explain this, but helping patients with reminders. The ID card needs to be renewed every 12 months. That's a $75 fee in order to renew that with the state of Florida. But in order to get the prescriptions, and that's not the right word, in the state of Florida, we're calling them orders or recommendations. Again, we are not doing prescriptions because it's a Schedule I drug. We're just giving you recommendations, but those recommendations expire every 7 months. So you'll see that the ID card renewal and the renewal for your order sets or your recommendations, they never line up, and that can cause a lot of confusion for patients. The visits do have to happen in office, in person, by a physician. That again is the legal wording. During any emergency order, like for example with COVID, we've been doing telemedicine, but this order will be expiring on May 8th, and we'll be returning to in-office visits afterwards. So this is our website. And again, I reference that frequently asked section box because I do have three more videos that go in a lot more detail, a lot more geeky information about the science of everything. But we are really helping people with getting back the quality of life. I feel like that is what our role is. We do a lot of community advocacy, patient advocacy, trying to educate doctors and patients and just community political people, because it's really benefited a lot of patients. And I'll never be able to really fully discuss or explain the benefits patients get, because I get the honor of hearing patients in the confines of a very private, confidential patient-physician relationship, and people telling me that they almost committed suicide. They would have never told me that the day they met me, right? Um, but the benefits patients are getting when they thought they had no other options is really miraculous. Does it work for everybody? No, but no blood pressure medicine or diabetic medication works for everybody either. And do patients have to do a lot of trial and error? And yes, most people don't figure it out until at least a month or even 3 months. Or I have some patients still at a year saying, you know what, I'm getting the benefits, but it keeps getting better still because I'm still trying things. So we do have to be open to being a little bit experimental, and I feel like that sometimes rubs people wrong. Nobody wants to be a guinea pig, but just think about it as, again, a medicine. You're an experiment. Every time I hand you a blood pressure medicine, I don't know if it's going to make your lips swell or cause you a cough, or if it even will address your blood pressure. If it doesn't work, hey, just come on back to me and I'll prescribe you something else, right? That's what it is with cannabis. There is a lot of individualized treatment for it, and I feel like our clinic does really good on educating the science, and so that way you can have a very good strategic approach, and patients are welcome to email us with whatever diary, whatever responses, and we can help tee up and just email back or do consults if we need to get back on track, but to really have a good approach of fine-tuning medical needs. So that is my presentation, just basically about the myths, trying to get the basic understanding. And I have